Andrei, who's your target audience?
3 years experienced injectors, 3 years injectors,
Yes.
experienced injectors, surgical and dermatological audience. So I have to show them the difference between OBT and Nasha technology.
Excellent, thank you.
Thank you. Okay. So in 10 minutes, I will try to simulate that I'm at a symposium, let's say in Lagos, Nigeria, in 2042. So, the importance of tools in our practice. We are all here dermatologists and surgeons. We have some experience, and we have to know that as a surgeon, in the past, we used tools that help people. So that's the reason why we have to think forward and to use new tools, new technology. We don't have an option to go back. That's the reason why I think it is very important to see ahead. Again, as a dermatologist, maybe in the past we used just our eyes or some loupes, but now we have other technologies like dermatoscopes, and we are embracing it to use it. But both of us are aestheticians. So in that order, the past was one syringe. Now, in order to obtain more natural result, in order to embrace the technology, we have to go ahead and see the entire portfolio. I know that some of us are, let's say, not afraid, but are struggling to understand all the product, and it's easier to use one product for all part of the face. But once again, we don't have an option, so we have to go forward. Good. When we're speaking about Restylane portfolio, I don't think I have to tell you about the studies, because it's the first hyaluronic acid discovered in 1996, covered but about of a lot of studies, and is the one of the most safety product in the world. Now, Restylane is having two technologies. One is Nasha, non-animal stabilized hyaluronic acid. It is designed for lifting and precision, and the other one is designed for contouring and expression, OBT technology. What I want you to understand is that those technologies are complementary, so we have to use them together according to the patient's needs. What is in the Nasha portfolio? So we have Classic and Lift. These are fillers. I also have to mention Vital and Vital Light, that are skin boosters. Nasha technology is a product that will be firm, very firm, will be very good targeted product integration, natural enlargement for minimal modification, more pronounced lifting capacity for projection and definition, enhancing cheeks and filling wrinkles and folds. Nose, chin, and jawline, where precision is needed, is very good option to go with Nasha technology. The other products are Refine, Define, Kiss, and Volime. This is OBT, Optimal Balance Technology. Is defined by more flexible gels. We tend to use them where we need expression and we have dynamic lines. Again, these products are for contouring and expression, varied degrees of cross-linking and calibration, soft and flexible gel, distributed product integration, contouring of facial features and dynamic treatment area, contouring and volumization of the mid-face, animated area such as lips, nasolabial folds, and marionette lines. Here we have a diagram that can show us, that is showing us the firmness of the product, where we can put them. So as we can see here, Lift is the top of the line, the most firm gel. It is a NASA technology, as well as Restylane Classic. The others are at the middle. The most flexible gel is Refine, used for fine wrinkles. Kiss, Volime, and Define, I would say that they are mediocre depending on what do you want to treat. Finesse is the last one. In this other diagram, we have the other product that we have on the market. So the one that get, let's say, the most closer to Lift and Restylane Classic is Volux. All the others you can see that have different places in the diagram of firmness and flexibility. So, going further, when we are buying new stuff, we are having a user manual, even if it's a phone or an electric or a car. But most of us forgot that, and we are going more intuitively, and we're using our products, let's say, how we feel or how we wish. But in order for us to be professional, I think it's very important to respect the area and the recommendation that the company is giving to us regarding the products. But to make it more simple, as I said previously, NASHA and OBT technology, NASHA firm gels and OBT flexible gels. NASHA doesn't attract water, OBT is attracting water. I am splitting the face, and I will say that the medial face will have more dynamic, more, let's say, movement of the face. It is suitable for OBT, so you have to have that in mind. The only exception is the tear trough, where we don't want to attract water. That's the reason why OBT will not be put in that area. But the rest, the nasolabial fold, the lips, the marionette lines, it's suitable for OBT technology. Also, there is another exception, the back of the nose, where again we don't want to attract much water and we want to be as precise as possible. Then we will use NASHA technology. Your guide to product selection. So TIPS, it's an acronym: tissue thickness and skin development, envelope, indication, plane of ejection, safety and selection of the product. We have tissue, soft thickness, what do we need to look for? Analyze the skin quality, what is the texture, does it have healthy grow, radiance, is the skin thin or firm? What is the thickness of the and the firmness of the epidermis, etc. Indication, what do we need it for? So establish what area and indication of the face is treatment directed. So what do we wish to achieve? We wish to achieve beauty, rejuvenation, or create more masculine or feminine look. Then review the patient profile, treatment area, your skills, and the plan of injection. Platform and structural support. What do we need to look for? Importance of taking into consideration the specific aspects of the bone anatomy, quality of the deep tissue, and so on. Safety, I think, is the one of the most important thing. Restylane products are one of the most safe products in the world for us and for our patient. So this is what we have to take in consideration. We are having a case review. I think that in the past we overfilled our patient. Now I think we have to consider to inject less and have more result. So lifting, as I told you, it is a combination. We have to combine the patient's needs. and define, pre and post. At the end, I'm just going to say one thing. Average injectors will fill your face. Good injectors will coat your face. But excellent injectors will restylinize your face. Thank you.